testifying before us. It really is a remarkable, if you look at the arc of what happened, and you look at it, actually take it all the way back to when Moderna was founded in 2010, and you came on board in 2011. I look at so many moments of risk and how many times, I don't want to alarm anyone, but the company could be at risk, and your margins were so thin you didn't have sufficient money to invest. And I think the notion of what the federal government did during a time of crisis, where we made, I think, a decision baked in wisdom to pursue 6 different solutions. Talk about multiple working hypotheses. And in your case, the federal government, BARDA, provided, I think it was $1.7 billion in your statement, you said. And that was money that really was after the earlier investments, which were largely in research. And those are public-private partnerships that money is invested. We do that, the government does that in all different levels. In this case, the $1.7 billion, you actually returned $2.9 billion? $2.9 billion. What was part of your motivation in that?
Thank you, Senator, for the comments and for the question. It's actually quite simple. As we were starting, so there's really 2 moments during the pandemic in the partnership with the government. First, focus on the vaccine development and accelerate it. That's what BARDA funding provided. Then we started to discuss with the government toward the end of the summer 2020 about purchasing vaccine in case the FDA would approve them. And as we started to have those discussions, we started to discuss with our board. And it became very clear, like 5-minute discussion at a board meeting, that we had to find a way to give the money back to the US government, because we all felt very grateful that thanks to that funding, we were able to accelerate the vaccine. I believe Moderna will have got the vaccine approved without the funding, but it will not have been by the end of the year. So Americans' life will have been impacted by that delay without the support. And so when we looked at it, we're like, if we're going to get the vaccine to work, we should provide a discount. And the board decided in 5 minutes, and that's what I put in my letter that I sent to the government in our first discussions for procurement.
Well, and it'd be an interesting calculation to look at how many lives were saved by accelerating that process with that $1.7 billion that was paid back almost, not quite double, but certainly more than just paying it back. And I am sympathetic to some of the issues as you look at pricing going forward, that this is something that has to be kept at a cold temperature. You're going from one customer to thousands of customers. You're looking at a 90% or 95% reduction in what you're producing. So all your manufacturing is going to have to be reconfigured. And I'm not an expert in pharmaceuticals, so I can't address that. But I think it is a complex issue that we need to spend more time looking at. And in these kinds of public-private partnerships, we want to get to the alignment of interests. And I guess my question is, you can comment on that, but I'd also, what do you think going forward, how can we do a better job of creating these public-private partnerships so that both sides feel they know exactly what they're getting and what's, that there's an alignment of that self-interest?
Thank you, Senator. Actually, the way we think about the price during the pandemic was actually a discount. We are talking here today about an increase in price. But if you think about what happens in any other industry, when you get a very large volume, you get a very big discount. That's actually what we did. We had 500 million dose order from the US government. This year, if we get 30, 50, that would be great. Actually, this year, if you look at analyst consensus, the company might be at a loss this year.
No, and you made that, I get, and I am sympathetic to that. I'm not sure all the other senators are as sympathetic as I am, but we'll have discussions. But I do want to get, because I've only got 40 seconds left, and or maybe we'll get an extra 20 seconds. What would you suggest in terms of going forward, in terms of improving public-private partnerships?
Thank you, Senator. I think making sure that the terms are clear. As you know, in enterprise, we are making decisions every day. And what we're trying to do is to allocate our resources to the best projects that we can do. And so I think being clear about what are the rules and making sure that the rules don't change later. That's what is really important. When we discussed about the BARDA funding, there was no discussion about commercial pricing. The focus was accelerate the study, get the vaccine to American people, save lives. And as you said, this was a great return for US taxpayers.
Right. No, again, I think you can't measure the success and the savings. I haven't added it up, but to figure out that discount, how much savings that was, and the benefit to the economy you did mention in your remarks. It's just a remarkable story. So anyway, I feel gratitude that you were there and able to step up and play such an important role in addressing really the worst medical crisis of certainly my lifetime.
Thank you.
Senator Cassidy.
First, I'm going to pass my ranking member seat right now to Senator Mullins while I walk across and ask in another committee, and then I'll defer to Senator Marshall for questioning.
All right. Thank you, Senator Cassidy.